Skin. Great. Okay. Good evening, everyone. Thank you, Anya. Thank you, everybody, for joining this webinar. My topic for today will be the beneficial effects of acupuncture treatment on patients with osteoarthritis and their associated risk to develop coronary heart disease. My name is Gil Ton. I'm a Chinese medicine practitioner, researcher, and lecturer based in Amsterdam, the Netherlands. And I think the weather is quite nice today, so I don't know why some of us are complaining.
Yeah.
Okay, so outline for today, I will talk briefly, it's a very short presentation about the association between rheumatic disease and CHD. And as well, we'll talk very briefly about epidemiological studies, what is known to be real world evidence, and I will introduce these research key points. So this article I published last year in the Journal of Alternative and Complementary Medicine. It was part of a research project in the PhD program I did in Taiwan, in China Medical University. So those of you with an eagle eye who notice the image here, that's the flag of Taiwan. It's also said, well, Taiwan, I love Taiwan. And yeah, this is where I spend 6 years of my life doing my postgraduate degrees. If you want to read this paper, you're welcome to download it. It's an open access paper. So rheumatic diseases, among more than 100 different types of rheumatic diseases, OA is considered to be the most common form of arthritis. In terms of epidemiology and risk factors, OA affects about 10% of the population. The disease becomes more common with age. After the age of 50, more women than men, unfortunately, I'm sorry, ladies, are being affected. And the most affected joints are the knee, hip, and hand. In terms of traditional risk factors, excessive weight, joint stress and overuse, and past injury or surgery are considered to be risk factors. But today we will talk about more of a modern understanding of the pathogenesis of OA and the role of inflammation in that. In terms of signs and symptoms, obviously pain is the most common symptom, stiffness and swelling of the affected joint, and as well loss of movement and function, which greatly affect quality of life. Patients with OA are also associated with depression and with disturbed sleep. And OA is considered to be a leading cause of disability worldwide and a major cause of healthcare expenditure. So as we can see from this figure, in 2009 in the US, the annual expenditure calculated in billions of dollars. So osteoarthritis had 29.5 millions of dollars. That's a lot of money, obviously. In terms of pathogenesis, traditionally, OA was associated to cartilage destruction, which in some degree involved with abnormal mechanics. So the term osteoarthritis, where itis is indicated for inflammatory process, is indeed correct. However, the question that researchers are asking themselves in the last 2 decades is it as a result of the wear and tear process, or does it the inflammation that promotes the destructions of the joint? So for a long time, OA was considered as a non-inflammatory disease that was the result of this wear and tear process. And therefore, it was often misnamed as a degenerative joint disease. However, OA pathogenesis is much more complex than that. And last decade, mainly, more research has been done about the role of vascular alternation, which may promote inflammation and leads to this joint disease. So the inflammation is the reason why the joints are being degenerative and destroyed. So in recent years, there are more studies showing the association between atherosclerosis and OA. And even more than that, there are studies that show the association between OA and CHD. So OA and AS share a common ground. OA risk factor has obviously joint biomechanics, while AS has the smoking. But in the middle, in the common ground, there are many risk factors, which include age, sex, obesity, vascular dysfunction, and the role of inflammation, and more specifically, the metabolic syndrome. So they share a lot of common ground between them, these two diseases. So our hypothesis back in Taiwan a few years ago was that it's unclear whether acupuncture treatment could prevent CHD events from occurring. No study has yet demonstrated this association back then. Our research group hypothesis was that acupuncture may have beneficial anti-inflammatory effects on OA disease. Therefore, we used Taiwan's National Health Insurance database, and we tried to answer this research question by using these databases. So the NHIRD database provides an enormous sample size to reduce selection and participation bias, and it includes long-term follow-up data. Also, it's considered to be very reliable database. So in short, about cohort studies or real-world evidence, as they are called, these type of studies typically observe large group of individuals, recording their exposure to certain risk factors to find clues as to the possible causes of diseases. So in our case, we have OA patients exposed to acupuncture as compared to OA patients who were not exposed to acupuncture. Then we start to follow them. And then we measure the outcome. Some patients develop CHD and some didn't. And then we do analysis and we see if it's significant or not. So this form of study is prospective study. We follow them forward. However, we can do the same while we have the data already, and we're going backward. And this is what it's called a retrospective study. So in terms of the pyramid of evidence, observational studies are not at the top of the pyramid, but they are quite high. They are ranked quite high, below systematic reviews and meta-analysis and randomized control trials. So due to that, causality, which is the relationship between cause and effect, cannot be determined with observational studies, with cohort studies. However, the value of real-world evidence is based on the non-randomized observational studies and the use for hypothesis generating safety and measuring quality in healthcare. So it can give us valuable information for health policy decisions and can determine association between causes and diseases. So in short, this is the study flowchart. It was a nationwide retrospective cohort study. We use a database, a data set with 1 million beneficiaries, which represent the Taiwanese population. They were randomly sampled to be part of this data set. And then we include patients that all 18 years older with at least 2 ambulatory visits or 1 hospitalization with OA diagnosis. Then we divided them to 3 groups: the OA with acupuncture, OA without acupuncture, and the last group was the general population without OA diagnosis. Okay, so we wanted to compare the OA group versus the non-OA group in the population. Okay, we exclude all kinds of patients who had previous diagnosis with CHD, patients who were younger, less than 18 years old, or patients who had missing information. And then very importantly, in this type of studies, we matched the 3 cohorts. So all the 3 cohorts were were identical in terms of age, sex, the index year of diagnosis of OA, so they were diagnosed in the same time more or less, and with comorbidities, because CHD and OA has a lot of other types of diseases, so they were all matched. They were all the same. So in total, we followed the patient for more than 10 years, or until the first incident of any kind of CHD, which was chosen to be the primary outcome. Okay, so totally we had 5,046 patients, 1,682 in each group, in each cohort, and the results were very interesting. So the first finding, the whole OA cohort without the acupuncture, this one, had a significant higher overall risk to develop CHD compared to the non-OA cohort, compared to the general population. As you can see, incident rate 6.5 compared to 3.2, it's double. Okay, so this data was correlated with previous investigation. So basically, this parameter answered our question that OA is considered to be a risk factor to develop CHD. Okay, but then the second finding, OA cohort with acupuncture had significantly lower risk of CHD compared to both OA cohort without acupuncture and with the general population. As you can see, the OA cohort with acupuncture incident rate of 2.2 as compared to 3.2 and 6.5. So it was a significant difference between the two cohorts, which means that the cohort with acupuncture, although the three cohorts were similar in terms of comorbidities, age, sex, and so on, the one factor that was the acupuncture part, the OA cohort, their association to develop CHD was significantly lower. In terms of medical expenditure, as well, we received interesting results. So as I mentioned before, OA is associated with high medical care costs as a direct cost for medical expenditure and medication, or indirect cost for time lost for both patients and healthcare providers. So as you can see, the OA non-acupuncture cohort was the most expensive cohort to take care of. And the OA acupuncture with OA cohort with acupuncture was the lowest and the cheapest to take care of. Okay, that was also significant. So in terms of discussion and the role of acupuncture mechanism, well, this presentation, it's beyond the scope of this presentation to discuss this mechanism, but in summary, we can say that acupuncture appears to reduce the incidence of CHD by exerting anti-inflammatory properties and by improving known risk factors for CHD. So previously, in Taiwan, there were publications that show that acupuncture decreased the risk for CHD in fibromyalgia patients, and as well, acupuncture decreased the risk of CHD in rheumatoid arthritis patients. Okay, so our investigation was the third one in a very large scale numbers that show that acupuncture has beneficial effects in OA patients and their hazard to develop CHD. As well, obviously, there are many publications which Aram mentioned before, and Anya mentioned before, about the role of acupuncture improving vascular function or improving lipid profile, lowering blood pressure, improving insulin sensitivity by reducing body weight, and so on. Obviously, this study has limitation, and it's mainly due to the nature of the database. Unfortunately, this database lacking information on lifestyle risk factors like smoking, dietary habits, family history, and so on. And also missing information in the database, detailed clinical evaluations are lacking. And also, unfortunately, we don't know which acupuncture points were used. The conclusion was very positive. Acupuncture appears to be a useful treatment to reduce the CHD risk in OA patients, but obviously more clinical studies, more randomized controlled trials are needed to confirm these findings. So that was my part for today.